Hi everybody. Today we are going to see about the promotive and preventive health strategies for mental health and mental hygiene, Unit 7. In our previous session, we had seen about the definition, concepts and characteristics. Let us start the today's topic. Mainly, the promotive and preventive healthcare strategies depends on three levels: primary prevention, secondary prevention and the tertiary prevention. In these three measures, we will see the role of nurse. First of all, primary prevention. What is the main role of nurse in primary prevention? Individual-centered interventions. Here, first of all, the antenatal care to the mother and educating her what are the adverse effects of irradiation, drugs and prematurity. Then, dietary corrections to the infants who suffer from metabolic disorders. Then correction of the endocrine disorders. Training programs for physically and mentally handicapped children. Counseling the parents. Then fostering the bonding behaviors. And explaining the importance of warmth care, accepting the individuals and how the relationship will be maintained. These are all comes under individual-centered interventions. Next, child-oriented interventions. Here, sensitizing parents and teachers on the concepts of both the growth and development takes place. Then, we need to identify the problems for the scholastic performance and the emotional disturbances among the school children. Third one, family-centered interventions. Here, first of all, we need to consult the parents about the appropriate disciplinary measures. What are the measures taken in order to keep the child disciplined? Then, we need to promote the open health communication. Some of the children will have the mind immaturity, thus they will have the fear to expose themselves. So, we need to promote the open health communication. Then what are the interventions to keep the families intact? Here we need to extend the mental health education to the child. Then strengthening the social support and promote the educational services. Provide the counseling with the people who suffer from the problems in their marital. We need to provide the counseling for the people who suffer with the marital problems. Then coming to the interventions for families in crisis. The crisis interventions may be mental hygiene clinics, psychiatric first aid centers and walk-in clinics. Then society-centered measures. Here, first of all, community development takes place. Then the families who are having the culturally deprived condition, both we need to supply the biological and psychological supplies. Then collection and evaluation of epidemiological and the biostatistical data. These are all comes under the primary prevention. Next, secondary prevention. What are the main role of nurse in case of secondary prevention? Early diagnosis, training, screening programs, early reference, prompt treatment, consultation services and the crisis intervention. First one, early diagnosis. Early diagnosis in the sense, whatever the case suffers from, we need to identify them. The people who are at high risk and we need to examine them and monitor the health condition of the individual is compulsory in this case. Second, training. Proper training of the health personnel is most important, because if we give the training to the health personnel properly, then in secondary stage itself the health personnel will be able to control that and prevent the spreading. Screening programs. Here they need to give simple questions which the normal people can also be able to identify the mental illness. In the type, the questionnaire must be developed. Early reference. For example, if the child is suffering from malaria, the people must be able to identify the early symptoms. For example, fever at a particular time, chills. The family members need to identify before itself. So they can provide the treatment before getting malaria to the other child. Prompt treatment. Prompt treatment in the sense early and effective treatment for the patient and counseling services to the family members. It helps to eradicate the disease. Consultation services. Consultation services in the sense the nurses who works in the general hospitals, they may come across the so many patients, those who suffers from cancer, puerperal sepsis, ulcerative colitis, like this different problems. So the basic care providers, they need the guidance and the consultation services. Final one, crisis intervention. Crisis intervention in the sense, if the crisis is not tackled in time, it may lead to the mental disorders. Finally, they may commit suicide. So, as a nurse, they need to identify before itself. In case of tertiary prevention, what is the role of nurse? Active participation, recreational activities, community-based programs, communication, community agencies, maintenance of patients, monitor community attitudes, and adjustment and recovery. Active participation. Active participation in the sense we need to encourage the family members to participate actively how they can eradicate the disease. Second one, recreational activities. The recreational activities should be organized in the hospital to prevent the diseases. Community based programs. Here it can be launched by meeting the family members. It can be implemented through the day hospitals or night hospitals, aftercare clinics, ex-patient hostels, like that. We need to give the follow-up care also. Communication. There must be the constant communication with the family members and the society. So, whatever they are having the doubts, we need to clarify them. Community agencies. Community agencies in the sense, the nurses need to be familiar with the community agencies, whatever provided in that area, so they can render the services. Maintenance of patients. Here, maintenance of patients in the sense, at their own homes itself, we need to train them to control and prevent the spread. Monitor the community attitude. Whatever the patients are having the stigma, we need to eradicate them by giving the positive attitude. Final one, adjustment and recovery. Here, the client must be adjusted to the surroundings and the climate so they can eradicate the disease. Next, we will see about the mental health services. Here, there are mainly 9 health services. Government mental health agencies, voluntary organizations, non-governmental organizations, we will call as NGOs, partial hospitalization, quarterway homes, halfway homes, self-help groups, suicide prevention centers, community group homes. Mental health agencies, those are voluntarily. Mental health agencies, voluntary organizations. Voluntary organizations in the sense, these are a valuable community resource for the mental health. So, they can play an important role in developing the suicide prevention and the crisis support for the individuals. Next, non-governmental organizations. Here, the government must be recognized with some non-profit organizations that plays a key role. For example, if we see advocates, service providers, researchers, they help in the development of both the human and the society. Next, partial hospitalization. Partial hospitalization in the sense, here it is the innovative alternative to the hospitalization. For example, daycare centers, day hospitals and day treatment program comes under this partial hospitalization. Next, quarterway homes. Quarterway homes in the sense, it is a place which is located within the hospital. So, most of the activities at the home can be taken care by the patients themselves. Halfway homes. Halfway homes in the sense, it enables the recognition of problems which requires the medical attention. Next, self-help groups. These are the associations of people with similar socio-economic background and desire to cope with the specific problem or life crisis. Next, suicide prevention centers. In India, the voluntary sectors doing the good work helping the people, those who are in need. So some of them are Sneha in Chennai, Sahara in Mumbai, Sanjeevani and Sumaitri in the New Delhi. These are some of the suicide prevention centers. And other mental health services include community group homes, large homes for the long-term care, hostels, home care programs, some district rehabilitation centers. These are all available under the other services. So, in this session, we had seen about the preventive and promotive healthcare strategies for the mentally health person and mental health services what are all available. Thank you one and all.